Hi there, my name is Jessica Shiomura and I'm a doctor of physical therapy in Oregon. I'm currently working at Impact Physical Therapy of Banks, which is a sister clinic of Impact Physical Therapy of Hillsboro. Now the clinic owner, Kent Bond, and myself got to interview Brett Bousquet, who's a doctor of physical therapy currently working for the Milwaukee Bucks NBA team. He was a graduate of the Doctor of Physical Therapy program from Pacific University in Hillsboro, Oregon. He also was a student intern and a physical therapist at the start of his career at Impact Physical Therapy of Hillsboro. Kent and I got to chat with Brett about his life as a physical therapist for an NBA team, as well as some of the differences between being a physical therapist for a professional sports team and how it varies from the outpatient physical therapy clinic. We hope you enjoy it, and thanks for watching.
Typical day on the road, and then if you were in Milwaukee, what would your day have been like in a homestand? So just take us kind of through that, if you wouldn't mind.
Sure. So, because obviously every day is so variable. Today, for instance, is a practice day after a game day. So we wake up, we get our COVID tests done. We'll usually meet as a performance group and just kind of discuss what's going to happen with our players, whether we have anyone in rehab, whether they need to do specific weightlifting, whether they need to do any kind of on-court progression, or if they need an off day or recovery, whatever that is. And then our performance director will go and chat with the coaches and make sure that they're aware so that they can organize a particular basket, whether it's before practice, after practice, whatever that is. Then we'll usually have breakfast, jump on a bus, go to whatever facility we're practicing at. And if guys need rehab or prep or anything before that, they'll swing in. We have a treatment table, a treatment room set up. We'll work with them. We usually send them into the weight room to do some form of activation, get to the arena, hand out shoes, do a little warm up. They go through their practice. They cool down afterwards. And if any guys need recovery, massage, whatever that is, they follow up with us. And then usually we have kind of the afternoon, late evening to find dinner on our own, or just do whatever we need to do to prepare for the next day. Some guys like treatment right after practice. Some guys like treatment at midnight. It really varies. So you get into a routine like that. And we're fortunate enough to have 3 PTs on staff. And so we can divvy up the 15 guys that we have so that it's not just a big burden on one person.
Yeah. And what other medical professionals, or I guess not necessarily medical, but like what other professionals do you work with in your group? Because I also watched your other interview, and there you were talking about the SNC guys and some of that. So who do you work with? Because that's a very different feel than what we work with in the outpatient clinic.
Yeah, absolutely. I mean, the NBA, it's just we have so many different resources at our fingertips, and it's amazing how you can have so many people, and from the outside you're like, wow, you have a staff of like 15, like there's only 15 players, like what are you guys doing? So yeah, we have 3 PTs, we have 2 SNCs, and so how it works is each player is assigned a particular PT and a particular SNC. And so we'll work closely, especially with rehabs or when we get new players in, we try and evaluate them to make sure that, they're functioning at an optimal level so that they can participate whatever minutes they need on court. We have 2 athletic trainers. They typically don't do any treatment. They're kind of more involved in more of the I wouldn't say the medical side. Well, it's more of the medical side as opposed to like a performance side. We have a full-time dietitian. We have 3 chefs. We have a full-time massage therapist. And then my boss, our performance director, kind of oversees and kind of communicates all of what we have with other people. So yeah, going back to a question previously, pertaining to what it looks like at home. This will kind of give you an idea of the structure and kind of layout of what the guys go through. So our structure is that the PT is kind of like the director of treatment in a sense. And so makes the decisions in terms of, like recovery, what kind of PT treatment they're getting, what kind of strength and conditioning, what their court looks like. And so every guy will come in at a set time. We'll stagger them so that we get our hands on every player every day essentially. And so they'll come in, see PT, that can be for 15 minutes, that can be for like a 1-minute checkup, or it can be for something like 30 minutes, depending on how many minutes they played, if they're in an injury or anything. So after a PT, they'll go into the weight room, do whatever prep we've talked about, hopefully in our meeting. Sometimes we have to modify their weights program if they've gotten an injury or if they're just rehabbing from something. And then from there, they'll go out onto court and do what is called a vitamin. So this is, I think, unique to this coaching group. You got to get your daily vitamins, which is like one-on-one with a coach working on a particular skill set or working on a particular play or offense, defense, whatever the niche is for that particular athlete. And then so it starts with the rookies, and then it kind of drifts down to more of the veteran guys, so that by the time the veteran guys have finished their vitamin and subsequently the strength and the PT, now everyone's ready for practice. So everyone gets a lot of one-on-one care throughout the entire day, which is pretty cool.
Yeah, that's interesting because, you sort of touched on it that you have your injured athletes, but you still work with the non-injured athletes every day, right? Yeah. And I think that's just an interesting concept, which I think is great. Ooh. But we're trying, we have our high school that's close to us, and we typically have the injured ones come in, but it'd be great sort of more with that wellness feel. Yeah, absolutely. Being able to work with them when they're not injured. And yeah. COVID has really changed a lot of stuff for us out here. I don't know how it's affected your team, but we're finding that our athletes have been more sedentary, and so we're getting a lot more injuries, which is a little interesting. But it's nice that you're able to still regularly work with your athletes regardless of injury or non-injury. So.
Yeah, absolutely. I mean, one of the greatest things is that you can actually feel the tissue difference when like a particular guy that you see every day. And so obviously the best predictor of injury is a previous injury. And so we will check particular like range of motion or strength tests or whatever it is every day to make sure that they're tracking well and not exposing themselves to too high of an injury risk. And so that just kind of, I know I've worked in that training room before, and it's so tough because you have the influx of 50 guys all at once, and you're like, you can't do it all. And so, like I said, we're so lucky to have so many people on staff that, like the maximum people you'll see is 7 or 8 in a day, which it doesn't sound like a lot, but it definitely will end up filling an entire.
Yeah, well, you had mentioned again in the one interview, you were talking about the time with the patient. And I think initially you said, you're like, how am I going to be able to fill this appointment space? And then afterwards you were like, I need more, like give me more time. Yeah. And I feel the same way. We've been at places where you work really fast with your patients, and you want that more time to analyze and really I say it a lot, fine tune, and you had mentioned that you use that wording, fine tune. I think it's so super important for those athletes, that fine tuning aspect. So it's great that you're able to have that much time with your athletes. So
yeah, absolutely. We're really fortunate, and like I said, it's you can see almost the storm coming in with particular things, especially muscle strains. Like, oh, hey, there's a little more tone here. We've seemed to have lost a little bit range of motion. Like maybe we need to modify XYZ so that you can keep going for the whole season. Especially this year, we're playing every other day, and it's wear and tear on these guys' bodies, and just mentally, like we're locked in our hotel rooms. It's a lot. So and that's the social aspect of it too, just having the ability to have more time just chatting with those guys. And because they're a lot of them are young kids, mm-hmm. and some of them haven't been away from home before, and so you don't want to be like friends with them per se, but you want to have a social interaction with them and make sure that they're having a good time too. Because if I think that I'm getting lonely on the road, or I'm tired, I'm like, these guys must be going through something pretty similar too.
Well, talk about, you and I come from baseball backgrounds, and we know what Major League Baseball is doing with watching pitch counts and really regulating the innings on baseball pitchers. Talk about dosing. So in your team, you have your team, and who makes the ultimate decision on who sets? And obviously, all of these athletes have different levels of tolerance to their bodies, and talk to us about that, and how the determination of who needs more rest and how that goes about.
Yeah, that's a great question. It's something that we're continuing to try and tweak all the time. But it basically stems from this general measure of load that we monitor. So we'll put just a chip on these guys, and this chip monitors velocity changes, direction changes, total distance. There's a lot. Yeah, I know there's a lot of different kind of these like chips that are out there and indicators. And so the load metrics that we get isn't necessarily pertinent to any kind of real metric other than, we can compare to previous day or future drills or whatever it is. And so we've kind of broken it down into load per minute for particular guys. So obviously the load is different for our 7-footer compared to our 6-foot guard, and the change of direction and the forces and everything. And so load per minute for particular guys varies, and then particular drills will have a general load. And so we can kind of get an understanding of what the guys are going to be experiencing in a practice, and then we can outline the rest of the week and say like, hey, like we have a lot of like higher load days in a row. It might be good to kind of pull back a little bit on one of these days to hopefully prevent something from happening. And I remember at the start of the year, because you go through camp, and camp is like kind of like a 2-a-day thing, getting the guys up to speed, teaching the plays. And I was when I would go to bed at night, my hands were numb from the elbow down because I was doing so much manual therapy trying to get these guys recovered and ready for the next day's work. And so thankfully that's decreased, but so I'd say load monitoring is one way that we go about it. Another way is we will assess strength on a dynamometer of sorts. Just again, particular areas where guys may have previous injuries, just want to make sure like fatigue is going to be a big factor. And so if they can't reach a particular threshold, then again, maybe we pull them for the day or just modify some particular drills. And so just, I think knowing particular muscle requirements in different activities allows you to determine if a guy is ready or not. So one of the metrics we'll use, just taking a calf, for instance, since this is kind of a change of direction, a speed type sport, we expect all of our guys to be able to do 30 single leg calf raises. And if they can't do that, that's kind of a red flag for us. And one of the reasons for that is during an all-out sprint, which these guys will rarely reach top speed, but the soleus muscle can go experience between 7 to 8 times body weight. And it's like, we can't reproduce that in a gym. So the best way you can do that is by dosing speed work. So if guys aren't getting the work that they need on court, we know, hey, this guy's got a calf history or a hamstring history. Like we need to make sure that they're getting little microdoses of speed throughout the week, so that all of a sudden if someone gets injured and they're now all of a sudden playing 20 minutes when they're not used to playing any, they're not going to pull a hamstring or pull a calf or something because they have that tolerance already built up there.
Wow.
Yeah, I know, like with the single leg heel raises, I try to incorporate that with a lot of my athletes because I find like a lot of them aren't doing that.
Yeah.
And another thing the trend that I'm seeing is they're also not doing a lot of single leg exercises. And I'm like, whether it's basketball, we've had some soccer kids come in and I'm like, you're running, like you're in a running sport that involves other activities, but you need to be able to tolerate those single leg activities and the power of those calf muscles.
Absolutely.
So it's nice to hear, that we're doing similar things and kind of trying to replicate those similar ideas, because I think it is very important to prevent some of those injuries for sure.
Absolutely. Yeah. And for me, it's so fascinating knowing kind of what your body experiences when you're doing particular movements in sport. Like, baseball, for instance, the degrees per second that your arm has to experience, like we can't reproduce that with a rubber band. And so that's why you don't go out and throw, 120 pitches at 200 feet to start the season. So you have to build those things up. I thought one thing that's super interesting, this is an article I read a long time ago pertaining to the UCL in a baseball pitcher. And if you just take a person that's never thrown a baseball before, the maximum load capacity of just the UCL without any muscles around is like a pitch velocity of 81 miles an hour, and it explodes. And then we have guys throwing over 100. It's like, okay, well, how does this happen? Well, you have to build it over the course of time. And so I think just, having a better understanding of what the muscles have to experience will give you a better kind of like rehab plan or prep plan, and maybe help educate these guys like, okay, so for running, I need 2 to 4 times body weight single leg squat. I can't even do a single leg squat. Okay, well, then I have no business running.
Right.
Exactly.
But your audience don't want to hear that.
Brett, in a previous conversation, you had expressed to me the relationship that you have speed and agility people, you have power people. So in your sports group, talk to me how, so Jessica and I, somebody walks in here with an injury, we're kind of like an athletic trainer. We have to assess what is this injury. Then we incorporate our plan of care. What is our physical therapy? And then we have to be that sports performance person, their soccer or their volleyball, what kind of the sports demand. So we have to do all of that, and we have to do it in a half an hour. So now you're a physical therapist, but you have the luxury of having these other professionals with you. How do you work in that team? And so take us through that. What's it like working where you, as a PT, used to, when you're at the Olympic Training Center in Park City, Utah, you got to kind of do all of that. Now, how does that go?
Yeah, I mean, we're so lucky to have so many skilled and knowledgeable people with us. And it's great to be able to rely on a group and kind of use the group knowledge. And so I'd say, in order to be successful, you have to have a general understanding of everyone's expertise in every particular area. But other people are far more, like our strength and conditioning coaches are unbelievable. And they're so talented with rehab, which makes them extremely successful in this particular setting. But they're also so great at just like movement and strength and conditioning and agility. And so the way that it works for us is that they have an understanding of what we do and we have an understanding of what they do. And so just open communication lines are so important, in saying like, sometimes you need to be a little more direct from a PT. Like, I want this particular movement plane, single leg, this type of load, this type of rep scheme. But sometimes I'm like, any kind of sagittal, single, like whatever. And they're like, it just gives them a ton of creativity to be able to work through that. And so, I came in here pretty confident. I was, after PT school, worked a little bit, did residency, worked a little bit more. And I remember coming in here, I'm like, I seriously don't know anything about PT or rehab at this standpoint. And it's very humbling, like every kind of step that you take, that there are people that are there that know a lot. And so I think the ability for our group to just be open and honest and willing to work through and educate has been, amazing. And so it doesn't put any responsibility necessarily on one particular person. It's just kind of taken up by everyone, which is amazing. So I don't know if that necessarily answered your question, but we just have such amazing people here that are so knowledgeable and willing to work and teach and kind of educate. And if you step back and just try and make it as objective as possible, then the science will hold up there.
Now, you used to work in an inpatient setting. What setting was that? Was it skilled or in the hospital? I can't remember.
So when I first got out of PT school, I did travel therapy for a little while. And it was the first place I worked was at a skilled nursing facility. Yep. And I remember it's definitely PT and there's a ton of value to it, but having just finished an internship with Impact, I was like, I want to get back to sports. Like, that's where I really fell in love with sports. And the relationships are still there. It's just a unique kind of experience. And then
well, I started in the inpatient, which is why it was very interesting. And I remember when I transitioned to outpatient, I was like, I need same as you had mentioned again in that one interview, you were talking about not wanting to lose your manual skills, your hands-on skills. And I was feeling the same thing. And so I reached out and did some Con Ed courses, and I took one with, I think it was the National Strength and Conditioning Association. So I showed up there, and I had been to Con Ed courses with just PTs. Like, that's all who I had been with. And it was eye-opening for me, and I fell in love with it because I was there. And I remember asking people, I was like, oh, are you a PT? And they're like, no, like, I'm an SNC, or I'm an athletic trainer or personal trainer. And I like talked to at lunch one day, I asked one of them, I said, well, what's your career? What's your position? And she was like, I'm an exercise science. And I said, yeah, but like, what? And she's like, no, I teach exercise science. And I was like, oh, like, this is a whole weird, like, different concept, because again, I had been in just like the PT Con Ed courses. So it was such a great experience to be able to do that. And really, that's where I was introduced to those different aspects. Like, here we are, all fitness professionals, learning all the same Con Ed, but then applying it to our pieces of that puzzle, right? So like your puzzle with the PT and the SC, and then the athletic trainers, like, that's your piece, but we all learn the same stuff. So it was very interesting, and I was thankful for that experience. And so it's nice to hear, it's nice to hear when other professionals get a piece of that as well, because I felt like it was lacking, particularly when I was in an inpatient setting.
I mean, it's definitely such a unique experience that, because I feel like sometimes when we get in our clinics, we kind of get in our silos. You have to be good at everything, and you can't necessarily be a master of one particular thing. And so being able to work with so many diverse kind of people that we work with, I can still be focused on my PT stuff and still learn from them in their S&C, but still be able to kind of transition back and forth between that. And it's similar for them as well. So it's great to just kind of have the whole kind of gambit of PT from injury to all the way back, and even the performance, which is, hopefully what we spend a lot of our time doing.
With, one thing that I want to be respectful of our time. I know we kind of blocked an hour out, but how are we doing time wise for your schedules?
Yeah, we're good. I have a meeting in 30 minutes. So
Okay. Well, one of the questions I really wanted to ask is the big thing is this return to sport, and we're looking at more and more metrics. How do we, because we naively thought that what we were doing with ACLs or with UCLs, we're getting these people back to pre-injury rates. And then we're finding out with our Tommy Johns, 84, 85% of these Tommy John people are coming back and pitching better than they did before injury. We don't have that luxury with ACLs. We don't have that luxury with rotator cuffs. And so now we're going back and saying, okay, what are we missing? So one of the things, actually tomorrow night from 6 to 8, the APTA section, we have a PT podcast or a PT TED Talk on cognitive re-education for ACLs. And what are you guys doing with this? What metrics are you following for that thoroughbred to return that Achilles tendon rupture, that ACL back to professional level competition? What test and what do you guys do?
Yeah, that's such a great question. And it's obviously what we deal with all the time here. The thing that I will continually go back and fall back on and rely on is going to be the science behind everything. So first you have to understand tissue healing, and you have to respect those phases, because those don't change. You can get a couple days here and there on either side of it, but those typically aren't changing. And so then from going backwards from there, you have to rely on the science. And I try and always make every progression logical. So I think as PTs, the challenge that we have, and potentially why these ACL rates are so high, is that, yeah, we graduate them from PT and they can start going back to training, but like, what does training mean? So you're telling me that, like, okay, you can do a hop test without any fatigue, and now you can go back to a 2-hour practice like that. The jump is too high and too great, and we don't have the ability or the luxury to help them progress through practice. And so I think that's where one of the biggest downfalls of our profession is, and why re-injury rates are pretty high. Like I said, like we have so many professionals just with our team, and it's so that we can spend so much time with these guys. Like in rehab, it's not uncommon to spend 3, 4, 5 hours with a guy, just taking them through all of these progressions. And as a PT, like you can't get reimbursed for that. You can't spend an entire day with one athlete. And the second part, like, I don't think I'll regret saying this. I just kind of have to tiptoe around the lines a little bit. As PTs, we suck at strength and conditioning. We don't know what we're doing. We're so bad at loading people. And again, going back to just understanding the needs of the sport and what that looks like, and just trying to replicate that as much as possible. So I think that's where there's a downfall. And I think that's one of the things I've learned the most, is just logically progressing people. So, you know, a standard thing that we experience in the PT clinic all the time is return to running. And, you know, obviously Oregon has a lot of longer distance runners. And so I think just using the same principles of running as you do with sports, and just logically progressing. Like, you're not going to start off running 10 miles your first run out. Okay, so we're not going to send you out and do, like, what if a soccer player in their first practice, they're supposed to run 10 miles and they haven't run more than a mile in your clinic. Yeah. So I think that's kind of just trying to logically progress these guys in their practices when they're outside the PT clinic is where I think we need to focus, and where I think we can make up a lot of headway in these recurrent injuries. So there's not necessarily like one test, like right. I know the HOP test gets a lot, or ACL is a major focus because there's so many people who get it. But I think back to my ACL progression, yeah. I went through my own, and like I had no idea what I was doing, and I was running my rehab league. Yeah. So we're definitely missing the boat. But from the standpoint of like resources, it's so hard to, it's such a major injury, and it's so hard to spend the amount of time needed. Yeah, it's a tough one. It's really tough.
So at home in your training facility, you know, we've started working with some of the Chris Power stuff, the return to sport stuff, and we have some. I mean, and I respect the heck out of Dr. Powers out of USC, and that gives us a starting point, and we'll incorporate that. And one thing that we don't have in that module right now is some of the cognitive things. It's all pre-programmed. Yeah. You know, there's strength testing. What do you guys use for strength testing at your facility? Do you have a HUMAC? Do you have a KenCom, a Biodex, or what do you guys have, if anything?
Yeah, so our primary way of strength testing, we'll do some force plates. So we'll do jump testing. We'll do pogo testing. We really like to look at seated calf measures. Okay. And so that uses force plates. And then we'll use something called a Kengatech out of Australia. And it's got a bunch of different sensors, a nice kind of video screen that we use on an iPad so that they can see the particular metrics. And we'll do ISO reps with whatever particular muscle we're trying to assess, and then just develop a profile of that, and then try and bring them back to those numbers if there is a rehab, or reassessing if they have a history of injury, just to see, like, sometimes you'd be surprised, like guys say they feel great and then they test 70% of their one rep, and you're like, yeah, maybe we need to pull back a little bit so that you can recover, because and you might feel great, but yeah, you need a little bit more recovery in order to be successful. And then from a psych standpoint, we do have a sports psych that we work with a lot, and has been super, super helpful with a lot of these guys. Say the one challenge with that is that obviously they share a lot of information with one another, and we're not privy to that information. And for obvious reasons, I mean, I don't need to know anything that's going on with that, but I do think that some of that information might help us in determining whether or not, you know, we push harder on guys or pull back a little bit. And that's
interesting that you say that, because like when you were talking about the 70%, you know, one rep max, my brain was like, well, I was thinking like, what was their mental health that day? You know, like what's going on personally at home that could be affecting that. And then you totally went the route that I thought you were going to go. So, and and you're right, like it would be maybe not the details of what's going on, but kind of the general, like what's going on. Even with my regular patients in the clinic, we talk a lot about it. And we've had some patients that have had some stressful things come up. And, again, I kind of tell them, like, share what you want to share with me. But, what was your stress like over the weekend? What have you been sort of dealing with? And how does that affect how you feel today? And so it's interesting that you totally went the route I thought you were going to go. So I'm glad.
Yeah, no, absolutely. I mean, those connections are so important. And that's why it's so great that we're able to spend more time with these guys. Like, I don't think I could ever go back to a clinic where, you have to have 4 people in an hour. It's just, you don't get to have those relationships, and you miss out on a lot too.
Well, and again, with your time, I want to finish with you. What can you safely share with me? We talked previously, and you told me about a really neat kind of promotion that you've received, and what are you going to be doing this next summer, and what can you share with us on your promotion? I was impressed by that, and I thought, what a unique experience. So I want, if you can answer that, protecting whatever you need to protect, but also what is it about your job that you just absolutely, you've already kind of alluded to some of the things you love, and what's something that's really challenging? You're recently married, you have a home in Park City, Utah. So what are some of the drawbacks? We have this glamorous life that you're living and have all these resources, but you travel a lot. So kind of share that, and we'll finish with that about what your future holds, and the what I want to say, the fun things and the downside to being a professional like you are, and then what's the future hold for you?
Yeah, so we're in a very fortunate position in the NBA to have athletes from all over the world, and a couple of the athletes that I work with are from Greece, and so they like to go home to Greece, and they still need training in Greece, and so we're again fortunate enough as an organization to have the financial backing to be able to send me to Greece, and hopefully my wife to Greece this summer to be able to work with some of these guys. So yeah, there's definitely some perks in terms of travel, and in the off season we'll typically go and visit with our players in their home towns, in their home states, in their home countries, and often if I have a guy in a country that I think might be a little more appealing, I'll have them fake an ankle injury so that I can make sure that they're getting the best rehab possible. So two summers ago, I was lucky enough to go travel with Team USA basketball with a couple of our athletes. I got to go to Australia, then I got to go to China, see the Great Wall, and it's really cool to have someone else pay for your travel. But then on the flip side of that, I do have a wife that lives in Utah that's like, why would I move out to Milwaukee and sit in an apartment when, we have this house in Park City with skiing and mountain biking, and yeah, that's fair. And especially because we're gone all the time. So I'd say that's one of the biggest challenges, is not having my wife around, and she's been so supportive the whole time and understanding, obviously, and allowing me to have this experience. So hopefully I'll be able to pay it back to her at some point in the future. But yeah, some of the unique stuff, definitely the travel, and I try and remind myself every day, you look down at a piece of clothing you're wearing and you see the Nike swoosh and you see the logo, and you're like, oh yeah, like I work, that's what I get to do. I get to go to an NBA game every day. Like, we'll travel on a private jet, a chartered jet, and you walk out onto the runway and up some stairs. It's not normal for everyone, and it's a pretty cool experience. It's very humbling. You have to continually step back and remind yourself that, yes, it is a lot of hours and it's a lot of work and a lot of sacrifice, and I have so many people behind me that have helped me get here, which is amazing. And so you just try and share that wealth with as many people as you can, but it's an experience that a lot of hard work and a lot of luck have led me to, and I'm very thankful for it, and just always trying to give back in any way that I can.
Well, I want to make sure too that Jessica's had a whole of her questions, but I want to be very respectful of your time. I know it's very limited, and I just, think the world of you. I think of, the things that you did when you were working at our clinic, and the patients that you worked with even back then still talk about you. And, I think of, one thing that as a student, I was still playing men's adult baseball. I had Brett hitting me ground balls and pitching batting practice. Remember going over to the local high school and working out with me? I bet Brett was going, how did I get stuck with this old guy, But anyway, we both love sports. And anyway, I thank you very, very much for your time. This